fellow Virgin Islanders, residents, and friends. Good evening. As the world continues to struggle with COVID-19 pandemic, the health, social, and economic impacts continue to create unprecedented disruptions in our daily lives. As of 18th April 2020, the World Health Organization reported 2,241,359 confirmed cases globally, with 152,551 deaths. The World Meter reports that at 19th April 2020, a total of 606,654, or 79%, of the individuals with COVID-19 recovered or were discharged from medical facilities in which they were being held. The Caribbean region recorded 7,926 COVID-19 confirmed cases, with 1,055 recoveries and 394 deaths. We are all sadly aware that the British Virgin Islands has not been spared the ravages of this deadly disease. Of the 22 samples recently submitted to CARFA, 20 results were negative and 2 samples were positive for the virus that causes COVID-19. This brings the total number of positive cases recorded to date to 5, with 3 recoveries, 1 death, and 1 confirmed active case. 181 persons are currently in quarantine, and the active case is currently isolated in the Dr. D. Orlando Smith Hospital. Our collective prayers go out to the husband, the niece, the family, and friends of our fallen sister. COVID-19 is real. Increasingly, too many of us are losing family, relatives, friends, and acquaintances. The health surveillance team continue to conduct screening and monitoring in order to detect any active case of the disease that may not have been detected to date, and anyone experiencing a fever, with cough, or difficulty breathing is encouraged again to call the medical hotline at 852-7650. It bears repeating what we already know about COVID-19. We know that COVID-19 spreads fast, and we know that it is deadly. We know that the virus can spread more easily in crowded environments. And we know that prevention is the most effective weapon against this unseen enemy. This is why we acted early and aggressively to minimize the impact of this deadly virus on our territory and our people through a comprehensive strategy that involved enhanced screening at ports of entry, extensive public education on hygiene and sanitation, heavy investments in healthcare facilities, equipment, and supplies, heightened border security to guard against illegal entry, legal measures such as mandatory quarantine and prohibition of entry, including placing restrictions on the entry of commercial flights and vessels, while being careful not to disrupt the importation of cargo. And we also experienced and implemented a range of social distancing measures, such as limiting gathering to 20 persons and implementing curfew orders. These measures have been taken based on the best available scientific evidence with one goal in mind: to protect you and your loved ones from this deadly virus. This current curfew extension challenges all of us to find creative ways to meet our basic need for food and other essential items such as medication. The Health Emergency Operating Center has put forward a comprehensive territorial provisioning logistics plan, which prioritized the delivery of essential items to the poor and vulnerable household primarily, while allowing every household to replenish supplies through a variety of methods. The details of this have been explained before by the Premier, and I am sure throughout the coming days, more information will be forthcoming so this can be done in an orderly fashion. You are encouraged to be patient. I know that the time is fast spent in terms of your supply and your supply chains. As you would have heard, local supermarkets and grocery stores are accepting orders and making deliveries to home, while partnering with the government to prepare standard food packages of essential goods to be delivered to households that need it. Persons interested in registering for food packages can do so by dialing 852-7688. That is 852-7688 between the hours of 7 a.m. and 11 p.m. Note the hours, between the hours of 7 a.m. and 11 a.m. p.m. A mobile application with location services will also be made available for the submission of applications over the internet, which will enhance the efficiency of the delivery system using the GIS mapping technology. The Social Development Department continues to deliver specialized assistance to seniors and highly vulnerable households in collaboration with the Red Cross and Family Support Network. Social workers can be contacted at 468-9371 or 468-9384. I am assured, and hence I can assure you, that there is greater efficiency in this system as further work has been done to collaborate even closer in getting this work accomplished. Arrangements are also in place for persons needing prescriptions refill. Prescriptions can be emailed to pharmacy, PHARMACY, at bvihsa.vg, or sent by WhatsApp to 4401726. Information, including the patient's phone number and address, should be included. Once filled, BVI Health Services Authority staff will deliver the prescription directly to the patient. Again, I am assured that this process is flowing even better than it was before, and you will rest assured that we will be checking on this. Persons needing any COVID-19 related or any medical consultation can call the medical hotline at 852-7650 and can be booked for an online appointment review. The government has gone to great lengths at high cost to protect and safeguard the lives of our people in the face of this daunting battle against COVID-19. Each of us must continue to do our part to adhere to the laws and guidelines that have been put in place for our own safety and the protection of the ones that we hold dear. In less than 4 months, COVID-19 has claimed over 2 million lives. By remaining at home during this curfew period and adhering to social distancing, hygiene, and sanitation guidelines in the weeks and months ahead, the life you save may be yours, may be mine, a family friend, a neighbor. I implore you to follow the guidelines set out. These are troubling times, and there is a human side to COVID-19. We must not overlook the fact that in some places, they are braving the day that the number of deaths on a daily basis have now fallen to 500 or 600. They are rejoicing that deaths have now fallen to 500 and 600. When you embrace the human factor in this, you would appreciate that COVID-19 is real, it is deadly, and it affects lives. We thank you for your cooperation and understanding as we join hands together to get through these difficult times and come out stronger together. We'd like to say God bless this Virgin Islands and the people of the Virgin Islands. Thank you.